1. What role does lifestyle, including diet and physical activity, play in diabetes development? Lifestyle factors, particularly diet and physical activity, play a significant role in the development and management of diabetes, especially type 2 diabetes. The modern world's shift toward sedentary lifestyles and the consumption of processed, high-calorie foods has led to an unprecedented rise in diabetes cases, particularly in industrialized nations. The impact of diet on diabetes risk. The dietary choices that people make on a daily basis can greatly influence their risk of developing diabetes. Diets high in processed foods, refined sugars, and unhealthy fats are a leading cause of obesity, which is one of the most significant risk factors for type 2 diabetes. A high-calorie diet rich in refined carbohydrates, such as white bread, sugary drinks, and pastries, leads to rapid spikes in blood sugar levels. Over time, the body's cells may become resistant to the effects of insulin, which is responsible for regulating blood glucose levels. This process is known as insulin resistance, a hallmark of type 2 diabetes. Moreover, diets high in saturated and trans fats can contribute to weight gain and increase the risk of cardiovascular diseases, which often accompany diabetes. Conversely, a balanced diet rich in whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables can reduce the risk of developing diabetes. Whole grains, for example, have a lower glycemic index, which means they release sugar into the bloodstream more slowly, preventing blood sugar spikes. Furthermore, diets rich in fiber, particularly from vegetables and legumes, improve insulin sensitivity and help with weight management. The role of physical activity in preventing diabetes. Physical activity is another critical component in preventing and managing diabetes. Regular exercise helps maintain a healthy weight, enhances insulin sensitivity, and lowers blood glucose levels. Engaging in moderate physical activity, such as walking, cycling, or swimming, for at least 150 minutes per week can significantly reduce the risk of developing type 2 diabetes. When individuals exercise, their muscles use glucose for energy, which helps lower blood sugar levels. Additionally, physical activity helps muscles become more sensitive to insulin, allowing the body to use insulin more effectively. This reduces the strain on the pancreas and helps prevent the progression of insulin resistance. Studies have shown that sedentary behavior, such as prolonged sitting, is associated with an increased risk of developing diabetes. Individuals who lead sedentary lifestyles are more likely to gain weight, develop insulin resistance, and experience elevated blood sugar levels. Therefore, incorporating regular movement into daily routines, even in small increments, can have a positive impact on overall health and diabetes prevention. Stress, sleep, and diabetes. Risk beyond diet and exercise. Other lifestyle factors such as stress and sleep patterns also play a role in diabetes risk. Chronic stress triggers the release of hormones such as cortisol, which can increase blood sugar levels. Prolonged stress may also lead to unhealthy coping mechanisms such as overeating or consuming high-sugar foods, further increasing the risk of diabetes. Moreover, poor sleep quality or insufficient sleep has been linked to insulin resistance and higher blood sugar levels. Studies suggest that individuals who consistently get less than 6 hours of sleep per night are at a higher risk of developing diabetes. Sleep deprivation affects the body's ability to regulate blood glucose and may lead to increased hunger, cravings for unhealthy foods, and weight gain, all risk factors for diabetes. This is the continuation of Step 1. Let me know if you would like to continue with the remaining questions and expand the content. 2. How can individuals with diabetes effectively manage their condition? Managing diabetes is crucial to prevent complications and maintain a good quality of life. While diabetes, particularly type 2, is often a lifelong condition, Individuals can take steps to manage their blood sugar levels and minimize the risk of complications through lifestyle changes, medication, and monitoring. Diet and nutrition. One of the most critical components of managing diabetes is adhering to a healthy, balanced diet. For individuals with diabetes, it is essential to monitor their intake of carbohydrates, because carbohydrates have a direct impact on blood sugar levels. The focus should be on consuming low glycemic index foods, which cause a gradual increase in blood sugar levels rather than a rapid spike. Whole grains, legumes, leafy greens, and fruits with high fiber content should form the core of a diabetes-friendly diet. These foods help in slowing down glucose absorption and improving insulin sensitivity. Additionally, consuming lean proteins, such as fish and poultry, as well as healthy fats from sources like nuts, avocados, and olive oil, is important for maintaining balanced nutrition without contributing to blood sugar spikes. Portion control and meal timing are also crucial aspects of diabetes management. Eating smaller, frequent meals helps maintain stable blood sugar levels throughout the day, preventing both hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar. For those on insulin therapy, consistent meal timing can be particularly important to match food intake with insulin doses. Another dietary strategy involves carbohydrate counting, where individuals with diabetes keep track of the amount of carbs they consume in each meal. This helps them adjust their insulin doses accordingly and ensures that their blood sugar levels remain stable. Regular physical activity. Physical activity plays a dual role in both preventing and managing diabetes. For individuals who already have diabetes, regular exercise helps improve insulin sensitivity, enabling the body to use insulin more effectively. Exercise also helps lower blood sugar levels by increasing glucose uptake into the muscles, where it is used for energy. The recommended amount of physical activity for individuals with diabetes is at least 150 minutes of moderate-intensity aerobic exercise per week. Activities like walking, swimming, cycling, and dancing are excellent for improving cardiovascular health and aiding in blood sugar management. In addition to aerobic exercise, strength training 2 to 3 times per week is beneficial for improving muscle mass, which can enhance glucose metabolism. It is essential for individuals with diabetes to monitor their blood sugar levels before, during, and after exercise to prevent hypoglycemia, especially if they are taking insulin or other medications that lower blood sugar. In some cases, individuals may need to adjust their food intake or medication doses to account for the effects of exercise on their blood sugar levels. Medication and insulin therapy. For many individuals with diabetes, especially those with type 1 diabetes, medication is necessary to control blood sugar levels. In type 1 diabetes, insulin therapy is required because the body no longer produces insulin. There are several types of insulin, including rapid-acting, short-acting, intermediate-acting, and long-acting insulin, each with different onset times and durations. Individuals with type 1 diabetes often need to take multiple injections of insulin throughout the day, or use an insulin pump that delivers insulin continuously. For individuals with type 2 diabetes, medications may include oral drugs that help the body use insulin more effectively or reduce the liver's production of glucose. Common medications include metformin, which improves insulin sensitivity, and sulfonylureas, which stimulate the pancreas to produce more insulin. Some individuals with type 2 diabetes may also require insulin therapy, especially if their blood sugar levels cannot be controlled through oral medications alone. It is critical for individuals with diabetes to work closely with their healthcare provider to determine the most appropriate medication regimen and to regularly monitor their blood sugar levels. It is critical for individuals with diabetes to work closely with their healthcare provider to determine the most appropriate medication regimen and to regularly monitor their blood sugar levels. Blood sugar monitoring. Effective management of diabetes requires regular blood sugar monitoring. For individuals on insulin therapy or those with type 1 diabetes, frequent blood glucose checks throughout the day are necessary to ensure that blood sugar levels remain within a target range. Many individuals use a glucometer, a small device that measures blood sugar levels using a drop of blood obtained from a finger prick. More advanced options include continuous glucose monitors, CGMs, which measure blood sugar levels throughout the day and night via a sensor placed under the skin. These devices provide real-time data on glucose levels and help individuals make more informed decisions about their diet, exercise, and medication. Regular monitoring allows individuals to detect patterns in their blood sugar levels and make adjustments to their treatment plan as needed. It also helps in identifying episodes of hypoglycemia or hyperglycemia early, allowing for prompt intervention. Stress management and mental health. Living with diabetes can be stressful, and stress can negatively impact blood sugar levels. The body's response to stress involves the release of hormones such as cortisol, which raises blood sugar levels. Therefore, stress management is an important aspect of diabetes care. Practices such as yoga, meditation, deep breathing exercises, and mindfulness can help reduce stress levels and, in turn, improve blood sugar control. It is also important to address the mental health aspects of living with diabetes. Individuals with diabetes are at an increased risk of developing depression and anxiety, which can affect their ability to manage the condition effectively. Access to mental health support, such as counseling or support groups, can be beneficial in helping individuals cope with the emotional challenges of living with diabetes. 5. What are the long-term complications of uncontrolled diabetes and how can they be prevented? Uncontrolled diabetes can lead to a wide range of serious complications that affect various organs and systems in the body. However, with proper management, many of these complications can be prevented or delayed. Cardiovascular disease. One of the most common complications of uncontrolled diabetes is cardiovascular disease, including heart attacks, strokes, and high blood pressure. High blood sugar levels can damage blood vessels and contribute to the buildup of plaque in the arteries, a condition known as atherosclerosis. Over time, this can lead to narrowed or blocked arteries, increasing the risk of heart attacks and strokes. To prevent cardiovascular complications, individuals with diabetes should focus on maintaining healthy blood sugar, cholesterol, and blood pressure levels. This can be achieved through diet, exercise, medication, and regular checkups with a healthcare provider. Kidney disease, diabetic nephropathy. Diabetic nephropathy, or kidney disease, is a serious complication that occurs when high blood sugar levels damage the small blood vessels in the kidneys, impairing their ability to filter waste from the blood. If left untreated, diabetic nephropathy can progress to kidney failure, requiring dialysis or a kidney transplant. To reduce the risk of kidney disease, individuals with diabetes should aim to keep their blood sugar levels within a target range and manage their blood pressure. Regular screening for kidney function is also essential to detect early signs of damage. Nerve damage, diabetic neuropathy. High blood sugar levels can cause nerve damage, known as diabetic neuropathy, which most commonly affects the legs and feet. This can lead to symptoms such as pain, tingling, numbness, or weakness in the affected areas. Severe neuropathy can result in loss of sensation, increasing the risk of injuries and infections, particularly in the feet. To prevent neuropathy, individuals with diabetes should maintain good blood sugar control and regularly inspect their feet for cuts, blisters, or other signs of injury. Wearing comfortable shoes and practicing good foot hygiene are also important steps in preventing foot complications. Eye problems, diabetic retinopathy. Diabetic retinopathy occurs when high blood sugar levels damage the blood vessels in the retina, the light-sensitive tissue at the back of the eye. This can lead to vision problems, including blurred vision, cataracts, glaucoma, and even blindness if left untreated. Regular eye exams are crucial for individuals with diabetes to detect early signs of retinopathy. Managing blood sugar, blood pressure, and cholesterol levels can help reduce the risk of developing serious eye complications.